More than ever, emergency rooms are packed with people along with limited staff. To keep things running smoothly, ERs are asking you to stay home unless you're seriously sick. One hospital system came up with a way to be with you on your COVID journey virtually. Fox's Shaun Rabb has a story from Dallas.
Hospitals are just really overflowing.
COVID wards, ICU beds, and emergency rooms overflowing.
Just like there's not enough room for COVID patients, there's not enough room in the hospitals for people with other medical issues too.
More people coming to emergency now than at the peak of the Delta variant spread.
Some of the staff at the hospitals are out with COVID, just like other businesses. And so it's a real crisis.
Trying to curb the crises, Methodist Hospital System posting this message to its social media. Asking people not to come to ER for testing, but go to their doctor, a pharmacy, or a drive-through test site. Urging people to keep room in emergency for emergencies. Baylor Scott & White gone a step further.
What we have stood up at Baylor Scott & White are digital tools and journeys that allow us to engage and be with you.
Through the My BSW Health app, says Dr. Ashish Barad, when you're not sick enough to come through emergency.
What you will find are many different ways to interact with us. One is something called an e-visit.
You answer questions that help doctors decide what your symptoms may mean.
Many times can just say that these symptoms sound like non-COVID issues and really just don't need care right now. But then that also can step you up to a video visit.
If doctors see you and decide COVID diagnosis, they'll go with you on what's called a digital journey.
If you don't need to be in the hospital setting, then you can be at home and we can then engage with you in a kind of texting kind of fashion where we're asking how you're doing. You can let us know. And if things are starting to worsen in any way, then we can then step that up and then be with you as that happens.
The idea to keep you home where you're safer fighting a new scary virus.
Is a lot of patients, if you are having COVID, there's obviously just innate fear. And when you don't have a system or providers with you on the journey, you may feel alone. And we don't want you to feel that way.
That was Fox's Shaun Rabb reporting. If hospitals can keep you out of the ER, there's room for other emergencies, but they still want people with high fevers or who are struggling to breathe to, of course, head in.